Hi everyone, in today's video I would be talking about the answer key for the paper 1. So I am starting with 101 question. In this they are talking about basically there's a difference between the cardiac tamponade and tension pneumothorax. You have to choose among B and C in this question. So let's see what the history says. It says hypotension, then rapid shallow breathing, JVP is raised, heart sound absent on auscultation. We all know the difference between cardiac tamponade and tension pneumothorax. Main is the cardiac tone is muffled in cardiac tamponade while the breath sounds are normal. In case of tension pneumothorax, cardiac tones are normal while the breath sounds are absent. In this case, we have heart sounds are absent on auscultation. We have basically backstride where we have JVP raised, then muffled heart sound, and we have hypotension. So answer for this is urgent pericardiocentesis. Next is they are talking about poisoning. In poisoning they have giving some clinical features and you have to diagnose which poisoning they are. So they have vomiting, profuse diarrhea, bronchoconstriction, salivation, excessive sweating and meiosis, and presence of muscular fasciculation. So the answer for this question is organophosphorus poisoning. Next question is again a poisoning question where they have given the keyword methemoglobinemia, and methemoglobinemia is seen in the copper sulfate. We have nausea, vomiting, pain, discolored, hemolysis, rhabdomyolysis. Main thing is methemoglobinemia. It is seen in the copper sulfate poisoning. Next question is they are talking about the components of the SOFA sequential organ failure assessment. We have these: respiration, then coagulation we use platelets, then for liver bilirubin, cardiovascular in GCS score, and in renal we use creatinine and urine output. So we have serum bilirubin, platelet count, creatinine. Leukocyte count is not used, so the answer for this is 1, 2 and 4. Next 105 they are saying pustular retinopathy may be associated with. So the complications of acute pancreatitis, we have sudden blindness, pustular retinopathy. So answer for this is acute pancreatitis. Next question they are saying is characteristic triad of Zollinger-Ellison syndrome. In this there is no hyposecretion, there is actually hypersecretion of gastric acid. Rest 3 are right: severe peptic ulcer, gastrinoma and pancreatic neuroendocrine. This is wrong because it is hyper, not hypo. So the answer for this is 1, 3 and 4. In a healthy young adult, what proportion of sleep time is comprised? Rapid eye movement sleep. So here we have in a healthy young adult, REM sleep constitute 20 to 25% of total sleep, while NREM stage constitute 50 to 60%. They are asking rapid eye, so the answer for this is 20 to 25%. Next we have 108 question where they are saying idiopathic intracranial hypertension. Which of the following drugs cause idiopathic intracranial hypertension? So a number of drugs may be associated: tetracycline, vitamin A and retinoid derivative. So we have tetra, retinoid, vitamin A. Sulfonamide is not associated, so the answer for this question is 1, 2 and 3. Next question is which of the following are correct regarding to metformin? They are talking about metformin. The first statement, maximum tolerated dose is 2000 mg per day. No, it is actually 2550 mg per day. So the first option is wrong. Next, lactic acidosis is the major adverse effect. Then it's true. Lactic acidosis is the major adverse effect. Other than that, B12 deficiency is also noted. So 2 and 3rd is right. So answer for this is 2 and 3 only. Next we have 110 question. They are saying which of the following statement are correct regarding the short stature. In short stature what we have is, first they are saying linear bone growth rate are pituitary dependent. Then they are right, it is pituitary dependent. Next question is normal bone age in a child with short stature suggests hormonal disorder. That is wrong because bone age is delayed compared to chronological age in almost all cases of short stature. They are saying it is normal, but no, it is actually bone age is delayed. Exception, okay, so the exceptions are only 2: familial short stature. In this, bone age are equal to chronological age, and precocious puberty, bone age exceed chronological age. So the third statement they are saying is final height in boys can be estimated by adding 6.5 cm. So that's true. For boys we have to add 6.5 cm. For girls we have to deduct 6.5 cm. Next is replacement therapy with GH in GH deficient. Then yes, we recommend growth hormone therapy in these patients. So 1, 3 and 4 are correct. This is wrong. Next 111 question we have, which of the following drugs used to treat diabetes mellitus is least likely to cause hypoglycemia? So incretin based therapies are two, DPP-4 inhibitors and GLP-1 analogs. Under DPP-4 inhibitors we have sitagliptin, vildagliptin, all type of gliptins, while under GLP-1 we have exenatide and liraglutide. So they both incretin based therapies do not cause hypoglycemia. So the answer for this is sitagliptin. Next question, which of the following constitute differential diagnosis of hypocalcemia? So these are the differential diagnosis of hypocalcemia: hypalbuminemia, alkalosis, vitamin D, renal failure, hypoparathyroid, pseudoacute pancreatitis and hypomagnesemia. So we have hypomagnesemia, chronic alcoholism and pseudo hypoparathyroid. There is no Paget disease. So answer for this is 1, 2 and 3. Next is, which of the following are useful for the treatment of hirsutism? Then we have, in hirsutism we use combination of estrogen progesterone therapy. Estrogen alone also have a direct dose dependent effect on sebaceous cell function. Then next we have glucocorticoids, cyproterone acetate, spironolactones, flutamide, finasteride and alfronethine cream. So what we have in options are estrogen, finasteride, spironolactone. There is no role of amyloid in hirsutism. So the answer for this is 2, 3 and 4. Next 114, they are saying which of the following is a long acting insulin. We have the classification: rapid acting are lispro, aspart and glulysin. Short ones are regular, intermediate are isophane. Long acting we have glargine and ditamer. They are asking long acting, so the answer is glargine. Next question they are saying is, a 15-year girl present to the hospital. Basically they are talking about diabetic ketoacidosis because she has blood glucose 400, ketones 3+, blood pH acidosis, creatinine 1.4, and she is given the treatment IV fluid and insulin for that, but after the 4 hours she complains of inability to lift her limb. Now what is the next step to be considered in her management? So when you give rapid insulin, what happens is it causes hypokalemia. Hypokalemia leads to periodic paralysis of limb. So the next step is potassium replacement in this case. So the answer is potassium repletion. Next question is composition of oral dehydration solution. This question is going to be cancelled because both B and D are correct in this case. It happens every year in the UPSC CMS. 3 to 4 questions every year get cancelled because of the mistake in their options or in the question language. So let's see what is the composition. Sodium we have 75, chloride 65, glucose 75, potassium 20 and citrate 10. So all the options are wrong. Basically either should be B or D, but both are options same, so this question is going to be cancelled. Next question is, which of the following are correct regarding tuberculous meningitis? In tuberculous meningitis we use the fluid for the smear for the acid fast bacilli. Next thing is, culture remains the gold standard to make the diagnosis of tubercular meningitis. They are saying acid fast bacilli infrequently seen on direct smear of CSF. That's true. CSF culture is the gold standard. That's true. Expert MTB assay is a preferred initial diagnostic option. That's wrong. So the answer for this question is 1 and 2. Next is, which of the following is a subcutaneous preparation useful for treatment of osteoporosis? So denosumab is given subcutaneously in case of osteoporosis. So the answer for this is denosumab. Next question is, which of the following are correct with regard to osteoporosis? In osteoporosis, first statement they are saying is asymptomatic until a fracture occurs. That's true. Vertebral fracture causing back pain, height loss and kyphosis. Cessation of smoking comes under the management. Now they are saying smoking is protective. That is wrong. Actually we try to go for the cessation of smoking. So that statement is wrong. Next is, it does not cause symptom until fracture occurs. That's true. Vertebral fracture can present with loss of height and absence of pain. That's true. And it sometimes present incidentally as radiological osteopenia. That is also true. Then the last question is, which of the following are correct with regard to ankylosing spondylitis, then ankylosing spondylitis, the male-female ratio is 3:1. That is, in males it is more common. Anterior uveitis is the most common extra-articular feature, and we have bamboo spine. So the options are bamboo spine, that's true. Early morning back pain is rare. It is not rare, it is actually common. Uveitis is most common extra-articular feature, that is true, and it is more common, that is true. So 1, 3 and 4 is correct for this answer. So these are the last 20 questions of the paper 1. I hope you did well in this. Questions are really not that easy. They are tough, but don't expect the cutoff to be below the 250. It will fall in the range of 250 to 300. So let's see what the other question says in my next video.